Hi, Dennis here. A question I get a lot is how do I know if I chronically overbreathe? The answer is pretty simple. You need to do a test. It's called control pause test, which is developed by Dr. Buteyko. I'm going to help you out later on in this video how you can do it, and then you know right away. Then you know if you chronically overbreathe or not. Then you know if you hyperventilate or not, because it's the same. A lot of people who have asthma already know. So for example, if you do have asthma and you're looking at this video or you know somebody who has asthma, they also hyperventilate. Only the body decided it's going to be asthma or typical chronic overbreathing symptoms like, for example, anxiety or fast breathlessness or fatigue. And of course, it's not always when you feel fatigue that it has to do with breathing, but in my experience, a lot of the times it is. I think it's epidemic proportions at these times how many people have chronically overbreathing problems. Burnout is also a really big problem in society. And in my opinion, burnout is one-on-one connected with breathing. To do the control pause test, it's best to do it in the morning. But for now, if you're looking at this video in the evening or in the afternoon, you can do it. But to be really accurate, it's nice to do it a couple of days in the morning. But when your score is really low, then you do not need to do it the next day in the morning to check out if it's completely different, because it's not. Your control pause number fluctuates in the morning, evening, or whatever. For example, when you have really good rest and you slept really good, your score can be a little bit higher. When you have a stressful day, the score can go down. That's normal. But I don't think you need to think or worry about that the number is going to go up or down a lot, or you're sick before, for example. But if you're in a normal situation, the number is about the same. Okay, so are you ready? If you want to do the test, you're going to sit up straight. And you're going to breathe through your nose only. As natural as possible. So don't breathe more in and out like you normally do or louder. Just sit up straight like you're watching television or listening to somebody. And of course, when you're sitting down, you breathe in, you breathe out, like you normally do. After 2 or 3 times, breathing in and breathing out, the idea is that you close your nose with your hand. But first you need to have your telephone ready and put your telephone in second counting, stopwatch. You're sitting with your hand at the start button and you wait until you have a normal, natural breathing out. Then you breathe out, not loud, not like normal. You close your nose with your one hand, and with your other hand you press start. You turn the stopwatch away from you. Do not look at the screen and do not count in your head, because it's not a competition. Remember that. It's really important that you have as natural breathing as you normally do, and you do not push the number up, because then you're going to fool yourself. So you breathe out, you close your nose, press start at the same time, and you wait. Some people, after a couple of seconds, they think, okay, I need to breathe again. The first idea that you need to breathe again, you let go of your nose and you look at your screen. The seconds which are on your telephone at that moment is like your control pause number. This number is for now. If you start training, the number goes up. But for now, the number is really important, because it says how much flexibility do you have in your body without breathing in or breathing out. So it not only says something about your physical condition, your breathing condition, but it also says something about how psychologically you can stretch. For example, when you have a normal day, your control pause is a number, but when you have a stressful day, the number can go really down. So it says a lot, not only about your body, but also about your mind and your mental condition. If your number is 10 seconds and lower, if you ask me, it's really important that you start to train your breathing, because it's really too low. To give you an idea, when your number is 10 seconds, you breathe in and out for six persons, so you breathe in and out 6 times too much. If your score is between 10 and 20, you still have a lot of main symptoms. For example, you have fast breathlessness or fatigue or anxiety. It's also important that you start training, if you ask me. If your score is between 20 and 30, sometimes it's all personal, of course, but in my experience, sometimes people do not have problems, but when they had a stressful period, or it's busy at work, or they have stress at home, or they can get restless, or they can get breathlessness, or they can get fatigue, or whatever, but it's not every day, or it's not every week. Okay. Between 30 and 40, you can still have problems. For example, when you start to run, or there is you had a bad food or whatever, and then you can get not really comfortable. So, and in my opinion, when your score is 40 and higher, you do not need to train. To give you an idea, when your score is 30, you still breathe in and out for 2 persons. Okay? So, I hope to have given you an answer for the question, how do I know if I chronically overbreathe, or how do I know if I hyperventilate? Look at the YouTube channel for more answers to the questions I get. But for now, I want to wish you a nice day and hope to see you soon. Bye-bye.